good afternoon again, and thank you for giving us this opportunity to be on your show and also to engage with your audience. So like you stated before, my name is Rashad Paul Brothers. I'm from the Chicago Department of Public Health Office of Research and also a proud member of the CDPH Health Equity Index Committee, which is the author of this report that we're all very proud of. So I want to take a few minutes to really give a chance to my colleagues to introduce themselves a little bit deeper for you guys to all know what are the skill sets that were put into this wonderful report. So I'm going to start with Blair Akins.
Good afternoon, everyone. Yes, my name is Blair Akins, and I'm an epidemiologist here at the Chicago Department of Public Health.
Dana Harper.
Hi, I'm Dana Harper, and I'm also an epidemiologist here at the Chicago Department of Public Health.
We also have Sister Ya Simpson.
Yes, greetings, you all. This is Sister Ya Simpson, your favorite community epidemiologist. And yes, I am with the Chicago Department of Public Health as well. Thank you for having us.
And the last author of the report is Ms. Donna Scratching, who unfortunately won't be able to join us today, but she's leading our tobacco program for the health department. So today we wanted to give the audience, a brief highlight of this report that I hope everybody has read. But before we can dive into the actual presentation, we felt that it would be nice to give like a little background behind what came into place before we decided to come up with this report. So first of all, this report is the first of its kind that was published by the health department. It's the first of its kind for many reasons. First, the author are all 5 Black women that you have a chance to, well, you can only meet the 4 of them here, but 5 Black women who decide to come together and to bring a unique perspective on how to talk about health and health equity for Chicagoans. This brief also reflects all of our voices, our expertise. As you can see in the room, you have epidemiologists, you have someone from research like me and people from the tobacco team. So we all decide to bring our life experience, our expertise, and our voices to this report. Originally, it was supposed to be only a 1-pager. Unfortunately, there's so many data that we decided that, we could not just stick to 1-pager. And because there was so much to say and so much inequity that we could see in the data that we went through, we decided to focus our report on life expectancy and its drivers. And you'll be able to hear it a little bit later in the presentation, some of those drivers and the life expectancy gap. Another aspect of this report that make it unique is because compared to other data brief that you could see, this brief, you choose Black as the sole reference. So whenever you go through the graph and the data, you'll see we compare specifically Black to non-Black because we want the disparity, the inequity to be obvious to everybody that will be able to see it. And lastly, another aspect of the uniqueness of this brief is also, we also want to mention beyond just talking about data, some of the historical practices and root causes that led to the Chicago that we see today. So some of those historical practice, and I'm not going to go into details, but just to mention them briefly, we have the Chicago Race Riot in 1919 that followed the Great Migration. We also have the redlining, historical practices preventing Black people to get loan to purchase a home. We have predatory lending, we have white flight, we have the school busing and more. But also in the history, you have people like Jean-Baptiste Point de Sable, one of a settler who was recognized as the founder of Chicago, and also the first African-American mayor, Harold Washington in 1983. So even after 40 years, Chicago is still extremely segregated. And we wanted to start our book showing this, the fact that Chicago is one of the most segregated cities in the United States. And you can see it in this map, which represents, the percentage of Black population in community area. And Chicago has 77 community area, but only 23 community area have concentrated on the west and south side, have 80% or more of the residents which are Black. And in the map, you can see it clearly in the dark blue area that are represented. But also what we also wanted to show in that map, and it's in diagonal bar, it's represent high economic hardship. And high hardship indicates the worst economic condition that an individual can experience. So this is an indicator that is measured by epidemiologists, and they'll be able to give you more details. But as you can see in this map, is predominantly Black neighborhoods tend to have higher economic hardship. So the second map that we wanted to share with you today talk about the percentage of severe housing cost burden in each community area. Again, housing cost burden, it's the percentage of households that spend more than 35% of their monthly income on rent or mortgage. So in this map, you see that the darker blue indicate area where there is severe housing cost burden. And the area highlighted in the yellow have predominantly Black population. So nearly all majority Black communities have a high percentage of household experiencing severe housing cost burden. So we wanted to start with these map that to level setting the conversation that my colleagues are going to take on, particularly around the life expectancy and its drivers. Thank you. Yeah.
Yes, thank you. So getting right to it, we're really trying to bring out what it means to be living as Black people here in Chicago. But then that means we have to talk about death, right? What it means to be dying. And premature death is 4 times more common among Black Chicagoans as compared to other races, ethnicities, non-Black Chicagoans. As you can see in this table here, you know, we look at non-Blacks at premature deaths, and it's like 1 out of 20, right? But then 29. But then when we look at Blacks, we see instantly is 1 in 7, 14.4% of Black people are dying prematurely. That's a problem for us. So as we're talking about life premature death, we got to also talk about life expectancy. And as we're looking at life expectancy, we look at it in a trend analysis, right? We go from 2012 looking up to 2017, and we can see that that gap has increased in 2012 at 8.3 to a gap of 9.2 years difference between Black and non-Black Chicagoans. We are clear that in 2017, our life expectancy numbers were at 71.4 years of life, whereas compared to non-Blacks, we can clearly see is 80.9. And what we're thinking about here is this is pre-COVID numbers. And so if we weren't doing well then, we know since COVID, we're certainly not doing better. But this is what we need to deal with. Why is life expectancy such an important factor for us to look at? Because it measures your quality of life. And if we are not getting the highest quality of life, there's got to be reasons why that's not happening. And what you're seeing here are the 5 drivers that we've identified. We're clear, there are more aspects and elements, but we looked at the 5 drivers that's driving down life expectancy among Blacks, and that's chronic diseases, that's homicides, which you would call violence, right? We just used the term homicides. We have infant mortality among Black women, Black babies, HIV, flu, and other infectious diseases. And again, we have COVID numbers, but most of this is about pre-COVID. And of course, we have to talk about substance use, and we're doing it through the guises of opiate overdose deaths. So all but the chronic diseases are all issues around death. And we want to talk about how those deaths and chronic diseases and HIV and infections and all the other drivers are pushing the life expectancy of Black Chicagoans down. My next colleague will go into the specifics with the data with that.
Thank you, yeah. So the next chronic disease is for diabetes-related deaths. The death rate from diabetes Among blacks, it's higher compared to non-blacks. And that's 80.0 versus 47.6. And so that's a rate per 100,000 of the population. And for black females and black males, that's 67.8 versus 97. And that's also per 100,000 of the population. So the next driver is adult hypertension. So blacks are more likely to have hypertension compared to non-blacks. And that's 37% versus 25%. However, there are no gender differences. For black females, that's 38%, and for black males, that's 36%. And the next driver is for menthol smoking. So blacks are more likely to be current menthol smokers compared to non-blacks. As you can see, for non-blacks, it's 5.3%, and for all blacks, it's 17.9%. And for black females and black males, we have 15.2% versus 21.5%.
Okay, another driver of the life expectancy gap between between Black Chicagoans and non-Black Chicagoans is homicides. The homicide rate among Black Chicagoans is 9 times higher than the rate among non-Black Chicagoans. So that can be seen in the chart. For the homicide rate for all Black Chicagoans is 57.4 compared to 6.2 for non-Black Chicagoans. And then if we look at the right side of the chart, we can see that the homicide rate for Black males is almost 12 times that of the rate for Black females, with the rate being 100.4.2 compared to 9.5 for Black females. Another one of the drivers of the life expectancy gap is infant mortality. The infant mortality rate is almost 3 times higher among Black infants compared to non-Black infants. So you can see that in the chart with the square on red. For Black infants, the infant mortality rate is 11.4 compared to just 4.5 for non-Black Chicagoans. Another driver of the gap is infectious diseases, and here we're focused on HIV. So nearly half of all people living with HIV in Chicago are Black. And so you can see that in the chart on the left-hand side. You can see how the triangles are both just about the same for Black Chicagoans and non-Black Chicagoans, indicating that there's just about the same amount of Black Chicagoans living with HIV compared to all other race ethnicity groups. And then if we're looking at just between Black males and Black females, we can see that there's over 8,000 Black males living in Chicago with HIV compared to just over 3,000 Black females. And of course, we're all living through this pandemic, so we have to talk about COVID-19. And for Black Chicagoans have a higher COVID-19 mortality rate compared to non-Black Chicagoans. So this is data through 2020. And so you can see on the left side hand of the chart that the mortality rate for Black Chicagoans is 219 compared to 142 per 100,000 people of non-Black Chicagoans. And then if we look on the right hand side of the chart, we can see that the COVID mortality rate is higher for Black males compared to Black females in Chicago. And then the fifth driver that we identified as having the largest effect on the life expectancy gap is opioid overdose. The rate of opioid-related overdose deaths among Black Chicagoans is 3 times higher than compared to non-Black Chicagoans. So you can see in the left-hand side of the chart that the overdose rate for Black Chicagoans is 55.6 compared to just 20.3 for non-Black Chicagoans. And if we look on the right side, looking at Black males compared to Black females, we can see that the opioid-related overdose death rate among Black males is about 3 times higher than that of Black females at 87.9 compared to 28.3. So now I'll pass it back over to Ya to talk about some of the things that the city overall is doing and what the Chicago Department of Public Health is doing to address these differences.
What we're going to get right into is what the city of Chicago is doing as a whole, and then we're going to talk a little bit much more in detail what CDPH is doing. But the city of Chicago does have the racial equity rapid response team that they put together. They have a We Will city planning process that they've been talking about, but more importantly, that they're looking at how you can create more space for racial equity cohorts through this development of race and equity team, where they're going to be talking about leadership around equity work. And that is a very important point, because this is why this book exists, where we did not have the leadership that we needed. Let's talk about what CDPH is doing and leading right into the state of health for Blacks, a call to action. This book represents our call to action in asking people to look at what is going on with the health of Black people in the city of Chicago. But we also did it as 5 Black women, a call to action for us to understand what health equity means and how we're going to utilize it, not just in the community, but also within the health department. And because of that, and because of other factors that were going on at the health department, for the first time ever, there has been a position created that is now the Chief Racial Equity Officer, that is held at this particular time by Sandy Brown. The other thing CDPH has done is been able to really start creating a citywide health improvement plan. This plan has been going on for years, to be honest. It was Healthy Chicago 2.0, but now it's called Healthy Chicago 2025. That plan is out on the website, and it is a plan that is put together to talk about how we can improve the health of all Chicagoans, and is in reference to health equity. Now, one of the other parts that they've done is making the neighborhood data accessible to community members, using the I love Chicago Health Atlas. We're about to get another update of the Chicago Health Atlas. It's been revamped. And so I encourage people, if you used to go to the Chicago Health Atlas, to go back to it. It has now got a new look. It's got some other features to it. But this is one of the things that CDPH is doing to make sure that people can have access to current data. Now, obviously, we have to continue, as stated, dealing with COVID-19. That response is not over. In fact, it's getting more intense. But that response is identifying, creating that task force that has been able to address racism, especially inequities as it relates to getting tested, and now, of course, vaccines. And so there is a response team that is working on that. They're systematically targeting areas in the city of Chicago that have low vaccination rates, more importantly, who have high COVID numbers. So there are people out there being very intentional about how to address this COVID-19 response in the city of Chicago. With that has been the creation of the health equity zones. These are now 6 zones that has been touted, that is going to be more specific around health equity and how to control and deal with the social aspect of environmental factors and contribute to health. But right now, these equity zones are totally focused on dealing with and abating, hopefully, COVID-19 within the city of Chicago. But something fantastic really did happen that was unbeknownst to all of us. We were happy that we did get a visit from our Chicago mayor, Lori Lightfoot. She came to us at the health department. She signed a proclamation making racism a healthcare crisis. That has never happened before in anybody else's governmental process, but we are grateful that she utilized our book and she saw the value of talking about racism as it relates to the state of health for Blacks. So those things did happen, and that proclamation was actually signed in June, but I'm here to say that she came to the health department to see and talk and get a signature from all of us with the book. So that was a very proud moment for us. So as you heard, why are we a little bit different? And I think we brought that up in the beginning, and that is a call to action. This book isn't just about just reading some data. We want people to recognize that we need some action, some foot, some movement. And part of that movement is, first of all, we do want you to be educated and aware of what health equity is, how to deal with it, how to talk about it. Right now, we don't have a measurement for it, but we are moving toward what to be and what it should be defined as. We are also talking about not asking, we're demanding more funding be put in the right places for the right reasons for Black people's health to increase. So we're not saying that Others shouldn't, but there should be more resources and funding for this initiative. We're also engaging the community, doing just what we're doing here with you. This is an excellent approach to being able to talk shop, if you will, with other members of the community. We are engaging everyone because all hands should be on deck, and more importantly, all feet should be moving together. And finally, we really want to, as I talked about before, we have to not just acknowledge racism, but we have to dismantle it. I'm going to take it a step further. We got to call it out and we got to put it out. And that requires everybody, whether you're Black or non Black. Racism has to be handled from everybody's perspective because it cannot continue. It is causing our life expectancy to decrease. So we must address racism, acknowledging it, but more importantly, dismantling it away from our coffers as human beings living in the city of Chicago. So we say that these are the things that are most important to us as far as the state of health for Black, the brief itself, that life expectancy is really the driver here. It is the variable that is the most compared around the world. No matter where you are in the world, life expectancy is a variable that is used to talk about quality of life. And we have to do something about that gap of 9.2 years, even before COVID. So we know it's even further now. Another thing we want people to focus on is that this is not just the health department's problem. This is a solutions that have to come from everyone. We need to make sure that not only is it the health department working on things around Black health, but that the community is doing it, industry is doing it, all factors of life are doing it. We want to highlight the section that talks about health and root causes and inequities and disproportionately affecting the health of Black Chicagoans. Those drivers that you heard pronounced earlier today. And more importantly, making sure to give community the tools that they need to advocate for change. You'll hear my colleagues are going to talk about, you can take this to your alderperson, state rep, congressperson, which I did do, by the way, to make sure my constituents or the people that I vote for know about this book and can know that they need to be making some changes based on the data that we provided for them. Doing that type of work is what we need. And this is the pictures that we know that the data was sobering. I know you were shocked to hear and probably a little down that Black people's lives are at stake here, and we're not living as long. We're premature deaths, and we have the life expectancy is lower. But we got pictures of inspiration, honey. This was not to tell you how to be sad, but it was to show you how you can get glad and say, what can we do to improve it? And these pictures represent that. I just bring your eyes toward even the picture with the sister that's shouting it loud. She's making a joyful noise unto the Most High to say, we can and we will do better. That is what we want to bring to the table. What is it that we can do to make our life expectancy better for the health and equity of Black people living in the city of Chicago, our Black Chicago residents? So we thank you for that. These are just a couple acknowledgments. Of course, we want to acknowledge the HEC team, the Health Equity Index Committee. Again, we're 5 authors putting out this work. We definitely want to acknowledge the people that helped us at the Chicago Department of Public Health, the supervisors and the deputy commissioners that were a part of this, the Office of Epidemiology and all the other epidemiologists that worked with us. And guess what? To all the other people who did give us valuable information, whether they were epidemiologists or not. A lot of people poured their hard-earned time into this to make sure that it happened. And we want to give a shout out to our designers, Big Mouth. They came through in a mighty way. This was like started off as a 2-pager. It ended up being a book and is beautiful beyond our own imagination. So I want to make sure that we say thank you to them. Anybody can get this book. It's free of charge. If you can't get the hard copy from the health department, please go, as you can see, to www.chicago.gov/Black Health. And you can get a PDF that's been set up by our PIO office. Erica Duncan has happened to join us today as well. We want to thank her and acknowledge the PIO for our office for making sure that people can get this book for free. So thank you all for listening to our presentation, and we are looking forward to engaging with you more about steps and solutions for increasing and improving the health of Black Chicagoans. Thank you.